Some sources suggest that racial inequality and health status worsen the prevalence of medical debt, especially its impact on the historically oppressed and excluded populations. Structural racism, which led to the segregation of neighborhoods, especially in the pre- and post-Jim Crow era, inhibited equitable access to preventive care. The limited access to preventive care exposes communities of color to higher rates of chronic illnesses, including obesity, heart disease, diabetes, and asthma. A lot of people with limited financial resources cannot afford high out-of-pocket expenses, thereby having to postpone care, a phenomenon that reduces the overall quality of life. Some studies suggest that the American healthcare system, both historically and presently, has been characterized by racist policies that create barriers to exclude specific groups from accessing public health insurance programs. Low income and lack of insurance among communities of color implies that they end up with high medical debts. As of 2016, the median net worth of a black household was $17,000, $20,765 for Hispanic households, and $171,000 for white households. Occupational disparities imply that minority communities are less likely to benefit from workplace insurance. As of 2018, 28% of Native American/Alaskan Native adults, 22% of Hispanic/Latino adults, 12% of Black adults, 9% of white adults, and 7% of Asian adults were uninsured. Data from as recent as the first half of 2021 indicate that Blacks and Hispanics still remain uninsured at disproportionate rates. Differences in incomes, which translate to differences in insurance statuses, define the relationship between race and medical debt problems. Noteworthy, Blacks and Hispanics are more likely to have outstanding medical debts compared to whites. Inequalities in access to care, insurance coverage, income, occupation, and wealth are linked to the higher likelihood of minority communities struggling with medical debt. This in line with the fact that people of color have more debt in collections compared to their white counterparts. Minority communities bear the greatest burdens of medical debt, which worsens the racial wealth gap by draining money that other families without the related debts use in investments. Black non-elderly adults are 1.5 times more likely to be uninsured compared to whites, with the number being 2.5 times more for Native and Latin Americans compared to whites. Reduced or limited access to insurance implies that racial minorities are more likely to incur insane medical debts and subsequent challenges in settling them. The burden of medical debt, which averages at $727 for minority communities and $668 for white people, is more pronounced among people of color, with this phenomenon being associated with their relatively low incomes. Most southern states, which constitute 8 of the around 12 states that did not implement the Medicaid expansion, have disproportionately high numbers of uninsured blacks. A lot of Southerners do agricultural work and other low-paying jobs that do not offer employer-paid health insurance benefits. Non-elderly black people are more likely to live in the states that did not implement Medicaid expansion. Of the 13 states in which 1 in 5 adults has a medical debt in collections, 7 of the states did not implement the Medicaid expansion, and people of color represent more than a quarter of the state's population in 11 of them. Some sources suggest that 60% of the over 2 million Americans in the Medicaid coverage gap, who are those in states that have not chosen to expand, record some of the highest medical debt, are people of color. The worst part is the fact that the uninsured are required to pay the full amount first when they're seeking care, with the amount being 2 to 4 times what the insured pay. Low income among communities of color forces them to turn towards charity care whose information they don't get enough of to make informed decisions. Charity care is especially difficult to access for undocumented citizens who are more likely to be minorities since they cannot provide the information required for eligibility. 31% of non-elderly black adults, compared to 23% of non-elderly white adults, have past due medical bills. Other sources suggest that 26% of the minority population and 21% of the white population have medical debt, while others note that 28% of black households, 22% of Hispanic households, 17% of white households, and 10% of Asian households have medical debt. The high likelihood of minority communities to have medical debt implies that they are greatly impacted by certain credit scoring models, thereby limiting access to credit and opportunities to build wealth.